Welcome to Doctors on Call. I'm Jenna Miller. Modern day chiropractic care began with therapeutic spinal manipulation nearly 2,500 years ago. More and more chiropractic care has been recognized and approved worldwide as an effective form of medical care. Doctors of chiropractic treat tens of millions of Americans each year. This includes the adjustments of both adults and children. Even infants can benefit greatly from chiropractic adjustments. Oftentimes, it takes an injury for a patient to visit the chiropractor. The studies show that an injured patient is almost 30 times less likely to undergo spinal surgery if the first point of contact is a chiropractor rather than a surgeon. However, many patients report staying out of pain or avoiding injury altogether when they visit their chiropractor on a regular basis. Chiropractic care is our topic tonight on the 20th season premiere of Doctors on Call with our guest, Dr. Shelbe Darnell of Restoration Health and Chiropractic.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Regional Hospital, experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Grew up in Plainville, Kansas. She earned her bachelor's degree in human biology and her doctorate in chiropractic from Cleveland University, Kansas City College of Chiropractic, graduating cum laude. Dr. Darnell earned her 100 hours of functional medicine and chiropractic family practice from the ACA Council on Diagnosis and Internal Disorders. She has completed more than 300 hours of postgraduate study of diagnosis and treatment of internal disorders. Dr. Darnell recently expanded her chiropractic offices to include Plainville and Stockton. She has also served at Casey Court and Overland Park Regional Medical Center. Give us a call at 800-337-4788 toll-free with your medical questions about chiropractic care today on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or chiropractor. Thank you so much for joining us again this year, Doctor, on our season premiere of season 20. So let's first talk about why should a person choose chiropractic care?
So you should choose chiropractic care for any aches and pains that you may have. Maybe that's from an injury, or maybe you just experience stiffness or headaches, neck pain, back pain, any of those types of things. You should seek chiropractic care to see if you can make any progress and get any pain relief.
Absolutely. And what credentials, let's talk about you personally, and experience do you have in the field of chiropractic?
So my credentials are Doctorate of Chiropractic. That requires about 4 years of graduate school. That's after receiving a bachelor's degree.
Sure. Now, do all chiropractors, I know you can really only speak for yourself, but do they use the same or similar methods?
As far as a chiropractic adjustment, it is a similar method as far as putting motion into joint. That can be done manually with your hands, or you could also use an activator tool, which a lot of people know as a clicker tool. And so that modality technically is putting motion into a joint, which is what chiropractic care typically is looked at. There are other modalities such as ultrasound, electrical stimulation, dry needling, kinesiology taping, stuff like that, that not all chiropractors do, but some do.
Sure. We might dive into those a little bit deeper here in a little bit, but you had mentioned an activator tool. Can you explain what that is?
Yeah, so what it does is it clicks, and when the tool clicks on a joint, it is just adding a little gentle force into the joint. So same thing as a manual adjustment, it's just more gentle without like the manual thrust that most people think of with chiropractic care.
And why would you use the activator tool rather than the manual thrust?
It can be the patient's preference if they just prefer a lighter adjustment. You can also use it on like smaller joints for say like TMJ is one that I think of. You can also use them like on the sternum joints with ribs in the front. You can also, if you don't like adjustments, manual adjustments in the neck or in the mid back, you can use it really any joint of the body.
Sure. Now you mentioned TMJ. Let's talk about what that is and how you would adjust that.
Okay, TMJ is the joints here on the jaw, and it's just a fixation of the jaw, and that could be due to clenching, or maybe you bit down on something wrong and it causes irritation in that joint. It causes a lot of pain there, and so you can adjust that joint there and usually provide relief.
Okay. Now, is there continuous education involved in maintaining your medical license?
Yes, so chiropractors are required to do 50 hours of continuing education in the state of Kansas. It does vary by state, but we are required to do 50 hours. 20 of them have to be seminar type credits, and then 30 of them, well, I think 29 now, have to be what they consider category 2, which can be all different types, maybe reading research, stuff like that. And then they added just a new category, category 3, which is more chronic pain management or opioids. Yes, things like that.
Sure. Now, is that something that the category 3, you said that's just recent. Is that something
Yes.
that is required or just recommended?
It is required
Okay.
to renew your license.
Excellent. And why, do you know the reasoning behind them adding that category 3?
I think just the increase in the opioid crisis recently.
Sure, absolutely. Now, what types of issues have you seen the most success with in your practice?
Definitely headaches. That's a main one. A lot of times I get calls, I cannot turn my head, wake up and not turn my head. Rib pain, and then of course the normal low back pain.
Sure. And what is your process of getting a person back into shape?
Yeah, so for instance with headaches, a lot of the times we'll look at the muscles in the neck and in the back of the head. A lot of times those are tight on those patients, so I do a lot of muscle work to relieve that muscle tension and take that pain off of that area, and that usually gives a lot of relief, and that is the same with their neck pain. Ribs are the same way. Usually when a rib moves, it will tighten up the muscles in that area in order to protect it so the rib doesn't move any further. And so to have an effective adjustment for rib pain, you have to loosen the muscles first and then adjust it, and then that will make the adjustment last longer too.
Sure. Now, do you ever suggest other treatments alongside yours?
Yeah, so there have been a few times that I've had patients come in and their pain is extreme to where I almost can't even touch them. And so what I'm going to do, it would be extremely painful to them. So I have found great success with sending them to places like Second Wind IV Nutrition and Therapy, where they can go over and get maybe a Toradol shot or some fluids and stuff like that, and that can settle it down, and then they come back to me and we can do the typical adjustment muscle work, and I've had a lot of success with that.
So let's talk a little bit more about what that is and how that works.
Okay, with Second Wind IV Nutritional and Therapy in Hayes, they offer a lot of different things. They offer like Myers cocktail IVs, vitamin C, vitamin D shots, B12. They have a whole lineup of things, and that can be really useful just depending on what's going on with the patient. But the one that I refer to a lot is for the Toradol shot. So they can do it through an IV, or they can do like a shot of Toradol, and that is really good. It helps with their pain.
Excellent. Okay. Now, is there ever a point that you feel like you've done all that you can and that the patient may just need to be referred elsewhere?
Absolutely. And I, just me personally, I don't like to treat people for a long period of time without seeing progress. So if I see a person 2, maybe 3 times, and we are literally not making any progress, I'm going to refer somewhere else. But there are some patients that have just chronic issues that have been going on for years that maybe we can make some progress, but maybe not. And so I always say it's worth a trial of care, but just to be upfront and honest with some conditions that we're not going to see improvement with chiropractic care.
Sure, very good to know. And what can a patient do at home to improve their prognosis?
So I always, before a patient leaves my office, every visit, we just go over home recommendations, because we can make more progress if we're not just relying on what I'm doing, but if they can do something at home. So it's dependent upon their condition, but typically I'm going to suggest using heat. I'm going to show them at-home stretches that they can do, and then maybe using biofreeze or kinesiology tape, things like that they can do at home.
Okay, you've mentioned the kinesiology tape a couple of times.
Yeah.
Let's talk about what that is, how it works, and it seems like it's really taken off.
Yeah, so you probably have seen it if you've watched sports, the tape that looks like it's just laying on their skin. And so what that does is it sends neurofeedback to the brain to help heal that area, but you can also use it to stabilize any injuries, sprains, strains, or muscles. And so it's really helpful in not only stabilizing, but also promoting healing.
Okay, and you also mentioned BioFreeze. How does that work, and how can a client get their hands on it?
Yeah, so BioFreeze, the active ingredient is menthol, and so that when it absorbs into the skin helps the muscle relax, and then it also increases blood flow to the area. You can buy it over the counter, probably at any drugstore, Walmart, Walgreens. I sell it in my office, so you can find that really anywhere.
Sure. And then you had also mentioned heat. Sometimes you'll hear you need to heat it, you need to ice it. How do you know what you're supposed to do? Do you prefer one over the other?
Yeah, so I definitely prefer heat. However, there is a time for ice, and that's usually within 24 hours of an injury. Using ice takes the blood flow away from an area, so if you injure an area and put ice on it, that can prevent that initial inflammation. However, you don't want to do that for long periods of time because you can also stop healing that way. If you're constantly putting ice on it, you're not getting good blood flow to the area. So although it is good to reduce inflammation initially, I like using heat to bring blood flow to the area to add, makes the muscles more agile. And so and it usually, heat feels good to patients. So that's why I usually always suggest heat.
Sure. Now, can you overheat, or can you heat too much, too long?
There are certain conditions in which you don't want to heat. There are also certain health conditions in which you don't want to use heat, especially if you don't have good sensation. You have to be careful with causing burns. They also, if you have cancer, you don't want to increase the blood flow to those areas as well. So it is patient dependent.
Sure, absolutely. Now, is there any truth that there might be some soreness following a chiropractic treatment?
Yeah, so I personally do, with my treatments, there are sorenesses. If you go and just get adjusted, sometimes you'll be sore if you didn't fully relax, because if you tensed your muscles and then somebody thrusts into those muscles, that can cause some soreness there. But especially with the muscle work that I do and dry needling, there will be soreness just because we're trying to break the muscle fibers back down and re-lengthen those muscles. So you would get a soreness just kind of like if you were working out and lifting weights and trying to build that muscle back up, you'll get that soreness.
And what can a patient do to try to relieve that after an adjustment?
You can increase your water intake, that does help, and then also to just keep movement to the area. You want to keep that blood flow going, you want to keep using those muscles, and that will usually help decrease the soreness.
Now you bring up an interesting point, because I think sometimes you go to the chiropractor and you don't want to move because you think, is there any truth to, or you said keep moving, that's what you want to do?
Yeah, I'd suggest to keep moving. Now there are times where you don't want to overexert, especially in things like when your ribs are bothering you and we have to adjust a rib. You don't want to overdo it in that area because those can easily move back. So those are few cases, and then especially with like low back pain or SI joint pains, you don't want to do a lot of bending over or bending and lifting because that can cause things to move where you don't want.
Sure. And what about exercising? Can a person get done with an adjustment and go right out and start exercising again?
Yes, and that can be patient dependent, condition dependent too, but for the most part, yes, you can.
Okay, good to know. Are there ways a person can prepare themselves for a treatment session?
Depending, just going and getting adjusted, I think as long as you are relaxed and in the right mindset there, I think that there's not a lot of preparation to do for that. As far as muscle work and stuff, if you're having a really intense, maybe like spasm or something like that, I would suggest putting heat on it before you come in, because that'll just take the tension off the area, and that can sometimes help.
Sure, absolutely. We want to remind our viewers that we are talking to Dr. Shelbe Darnell from Restoration Health Chiropractic. Give us a call at 800-337-4788. We are live tonight, and you can give us a call if you have a question for our guest. Okay, so let's talk about, for a person who's never visited your office, what can they expect on that first visit?
Okay, so your first visit, you'll fill out I usually have people fill out the intake paperwork online. So They'll come in, we'll go over what's bothering them very, very thoroughly, what aggravates it, what makes the pain better, try and narrow it down. And then we do an exam to see what's going on, and I try and determine the root cause of their pain. And then once we do the exam, we talk about the treatment, what to expect, and then muscle work usually takes 15 to 20 minutes depending upon how many areas are bothering them. And then we adjust. I suggest their at-home recommendations, and then if they need a follow-up visit, we'll schedule it then.
Excellent. Okay, we might talk about that a little bit more here, but we've got a caller waiting to ask a question, so we're going to go to the phone lines. I believe they said they have Amy on the line from Hayes. Go ahead with your question for Dr. Darnell.
Hi, I have that cough that everybody seems to have right now. Gone to the doctor and they say, you know, it's viral, nothing they can do. Didn't know if that was something you can help with, or would you have suggestions of things that we could do at home?
So my suggestion is you definitely want to try and help your immune system. So things like elderberry, vitamin C, things like that. And I'm going back to this, but Second Wind IV Nutrition and Therapy, the IVs and the they have vitamin C's. I think it is called the Myers cocktail. That is really good for immune boosting. But if you call there, you can ask them that question and they'll make a suggestion. Anything that you can do to boost or upregulate your immune system, I think is really helpful.
Sure, and so you do not have to have a doctor's referral to get into
Nope,
the IV?
nope.
Okay.
They're walk-in. You can schedule online, but they're very helpful. So if you call and ask, they'll be able to tell you what they suggest.
Excellent. Now you mentioned before our phone call that you do the muscle work for 15 to 20 minutes. Can you explain what that is? Because I think a lot of people think you go into the chiropractor, you get adjusted, and you're on your way.
Yes. So the muscle work that I do technically is instrument-assisted soft tissue mobilization. So what that is I have a metal tool, and the best way I can describe it without having one here is it looks like the back of a butter knife. And so I use massage lotion and a little bit of biofreeze, put that on the skin, and then you use that tool. So kind of like rubbing up and down, and that will break up any adhesions or scar tissues in the area. And then I just use long sustained pressure with my thumbs or my elbows, depending upon the area, and slowly try and re-lengthen those muscles.
Okay, excellent. And then following that muscle work, that's when you do your adjustment?
Yes.
Okay, excellent. Now let's talk about some of the conditions that chiropractors, I know our caller was asking about this, the cough. You wouldn't necessarily think of a chiropractor to help with that, but you were obviously very helpful. So what are some other conditions that a chiropractor treats?
One big one that not a lot of people think of chiropractor is plantar fasciitis, especially with the dry needling that I do. It can be very helpful, and plantar fasciitis can really take a toll on people, and sometimes people just feel helpless with that condition. So that is one that I always think of. And then elbow pain, carpal tunnel. Recently I've had some patients that have had carpal tunnel surgery even still having issues with hand numbness and tingling. So that is also one. The patient said, I didn't even think to tell you about this before, but we treated him with one treatment, dry needling adjustment, and he told me, his wife told me a couple days later that his pain was gone. So
that's amazing.
Yes.
Now you had mentioned the plantar fasciitis. If somebody maybe has symptoms of that, but they don't know what it is, let's explain that.
Okay, so it's pain on the bottom of your foot. It can be usually in what you think of the arch, but it can also be around the heel, and it's very painful when you step on it. A lot of patients will say it's kind of worse in the morning after they haven't been using their feet, but it is really painful when you've been on your feet for long periods of time as well.
Sure. And you mentioned dry needling, so let's
Yes.
explain what that is and how you, what a session with that is.
Yeah, so dry needling, it's called dry because it's not a wet needle that has a hole when you're like when you're getting a vaccine. So it's very small needles, and it's similar to acupuncture where you're inserting a needle. However, acupuncture follows the Chinese medicine chart. Dry needling is specific to you, your condition, and where maybe knots or trigger points are on your body. And so we're sticking a needle into that tight muscle or knot, and what can happen is you can get a twitch response. So your muscle will twitch and then it will release, and that is the most effective part of dry needling. However, it can also be the one that is the most painful. and cause the most soreness. So the more twitches, usually the more relief, but you can also have soreness. And I will say it is one of the most effective modalities that I use in my office.
Sure. Now, how long is a dry needling session for you?
Dry needling is actually pretty quick. Usually only takes 10 minutes at most, depending on how many areas you treat. But to needle, you usually needle 2, maybe 3 places in one muscle, and then I like to follow back through with my muscle work in that muscle to just make sure we are re-lengthening it, and then usually follow up with an adjustment as well.
Sure. And you mentioned your patient with a carpal tunnel. Explain how you treat that.
Okay, so carpal tunnel, you can have a release in your wrist done of the ligament that holds that nerve, and that is the surgery he had. But usually what happens is these forearm muscles here that attach get really tight. And so you think about people that are like swinging a hammer or doing a lot of typing or any motion that you're using your wrist back and forth, these muscles get extremely tight. And so if you can loosen those up and then maybe adjust the elbow and adjust the wrist, you can usually see relief with that.
Now, let's talk about chiropractic care benefiting those who maybe aren't very mobile during the day. They have a desk job or they just don't move. Let's talk about that.
Okay, so with desk jobs, I'm sure you've probably heard of like text neck, where your head starts coming forward because you're looking down. So you start coming forward with the head, you get like pectoral muscle tightness, you also get tightness in the back of your neck and in your mid-back, and you can start to get an increased thoracic kyphosis where you're coming forward like this because you're just leaning and trying to work so many times a day. So chiropractic care, loosening those muscles up can really be helpful. And then adjustments to that area to add motion back is usually helpful. And then you also want to think about retraining posture. So if you can, try not to look down at the desk, maybe raise your monitors, or raise, if you're like copying off paper, pull the paper up higher, keeping those shoulders back and trying to keep your head back and over your shoulders.
Sure. So you do hear about text neck, so it's a real thing.
Yes.
And we have a lot of children that are
Yes.
on, their electronics or their phones or whatnot. How should we be training them?
My biggest suggestion is to try and get whatever they are using up to eye level. So like, for instance, in the car, if your kids are watching like an iPad, instead of having them hold it on their lap, buy a headrest mount for that so it's up, so they're not just constantly down like this. It's harder in the like the grade school, high school ages, because the desks that they sit in are so close to them and they're doing a lot of work on the desk. So that's harder. And I'm starting to see where the thoracic curve, like this normal curve that you have up here, is starting to get lower in that age. And so they're curving at a lower spot like here. So it's just really important, like if you see your child doing that, to just remind them to like come up over their spine, up over the shoulders. It's so important because when you are forward, it tightens your muscles. And so it's going to cause issues down the line.
Sure. And I was going to ask about those issues. What kind of issues are we looking at?
Yeah, there's a lot of low back pain in high school aged athletes right now that I think could be prevented if posture was better, increase in water, and then stretching before and after their activities. I think that would be very helpful in those conditions.
Sure. So what age can an individual begin chiropractic adjustments?
At birth, you can have chiropractic adjustments. Now, a chiropractic adjustment on an infant is not the same as an adult. However, there are issues such as like colic or gas or constipation, things like that, that a chiropractor can be helpful for with an infant. Also torticollis if the baby's always lean to one side. So chiropractic care can be useful even as a baby.
Sure, absolutely. And on average, I'm sure it's patient to patient, but how many times do you usually treat a patient?
For like a very acute condition, an injury that just happened, maybe twice a week. I do have some people that come once a week, maybe once every couple of weeks, but just me, like my personal chiropractic beliefs, I'm not seeing people like 3 times a week or something like that unless they truly need it. It's acute because the muscle work that I do is pretty effective, and that's usually not necessary.
Excellent. Well, we covered a lot of stuff tonight. Thank you so much for coming and being our guest on Doctors on Call. On our next Doctors on Call, we'll be discussing wellness and prevention with Dr. Dustin Moffitt and Jessica Moffitt. You can email questions to us for our next program at doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.